So these are our exam sheets that we fill out while we're doing an exam on the animal. It always has the client's information, the pet's information, and then a picture of them. So up on the top here we have whether the vaccines are current or due, and we'll write in whichever is necessary. We always have the doctor who is doing the exam marked off. If it's an appointment, obviously there's a time here. Whether it's a new or client or new pet, that way if one of these are marked, one or both, we always verify the information on top. And then we always get a picture of them to help identify. And then every patient is assigned their own ID, where we can find to look them up or attach any blood work with that ID number. We do a weight and a temp. We do a body condition score. We use the 1 through 5. So this is a 3. So she's ideal right now. If it was a 4 or a 5, we would ask the doctor what the ideal weight would be. We do a pain score. Lets us know whether we need to get some pain medication on board or not. And then the surgery or ASA grade. And then we always have a place here for what diet they're feeding. So in case we need to know later on if they're having issues like diarrhea or vomiting, if it's associated with their diet quality or not. So with this exam form, we did just change it up a little bit. But here is the subjective. So we use SOAP. So subjective is what the animal is here for. And then also any information you get from the client. So is it eating and drinking okay? Is it having any vomiting, any diarrhea? Any information on why they're here. If it's like a limping, you'll ask, which leg, how long has it been happening, those kind of things. The objective is the doctor or technician findings. So we have a list here that we will go through individually, so that way we do not miss anything. So we look, the objective is the weight, the behavior, eyes, mouth, mucous membranes, ears, integument, lymph nodes, musculoskeletal, feet, cardiovascular, respiratory, abdomen, gastrointestinal, urogenital, neurological, endocrine. Those two we only do as needed. So if the concern itself is the dog is not using its back legs, we will then do the neurological. Endocrine we use a lot for cats, particularly if we're concerned it might be hyperthyroid. This allows us to remember to check to feel for any thyroid nodule. The radiology and lab results. So if the animal is limping per se or has a painful abdomen, we happen to take an x-ray. This is where we will put the findings, whether the doctor sees any collapsed discs, if it sees anything like any large swellings, or if the intestinal tract seems thickened, we'll write this under abnormal and radiology. And then the lab results is if we do particularly any in-house like urinalysis or PCVs or anything of that, we'll get results immediately. Fecal floats, we'll put those here. So the assessments are any rule out or diagnosis for this animal because it was a dog spay, and everything appeared to be healthy. That the rule outs would just be apparently healthy and okay for surgery. And so what comes into handy is if this was anything abnormal, like diagnostics, is if we are assuming the animal has, or our rule outs are something like pancreatitis, colitis. Our diagnostic plan would be to run a total body diagnostic. And so we would write this here. And then the therapeutic would be more like drugs, like pain medicine, antibiotics, those kind of things will be written here. And then any go-home client instructions would be written here. As far as diagnostics for, like, per se, a surgery, the routine dog spays, dog spay and neuter, cat spay and neuter, unless the animal is has any health concerns prior to surgery, we typically don't do any diagnostics. If it's any other one like our dental prophies, we always require at least an in-house general pre-op exam. An in-house pre-op screen. And then we would kind of go from there, depending on the animal. So, like, if it's a boxer, typically we would run an ECG because they have history of heart problems. So everything is a base by base system, and then also whether if the animal's predisposed to any diseases or anything that would cause complications while under anesthesia.